Hello and welcome to the program. My name is Marie Yambo at KBC Channel 1, and KBC Channel 1 TV is where you can interact with us. Coming up in this program,
it's pain I would not want to wish on anyone. It's debilitating, it's horrendous, it's horrific.
A pain like no other. Kezia Mumbi shares her journey with endometriosis.
It's the support system you've got. So if you've got dismissive home or work environment, that you're in pain and people don't appreciate that you are in pain, then you feel isolated.
And what is the connection between endometriosis and mental health? And later on Good Practice, we share some of the myths and misconceptions about endometriosis. According to the Kenya Demographic and Health Survey 2019, 1.2 million women of reproductive age in Kenya, that is between 15 and 49 years, suffer from endometriosis. Away from the public eye, Kezia Mumbi battled excruciating pain, especially during her menses. In this following story, she tells us her journey with endometriosis.
For the most part of it, I didn't even have a name. I just knew I was going through something. It was very severe, and yeah, I didn't know what it was.
Kezia's journey with excruciating period pain began when she was just a teenager. For as long as she could remember, she suffered from severe pain that no one around her understood, least of all, herself. At school, teachers dismissed her complaints as mere attention-seeking behavior.
Especially in high school, there was a thing of like, she's faking. She's faking to get out of class. She's faking to get out of, if my period fell during an exam. Hataki kufanya exam, ndo anajifanya, anajililisha hadi anajiangusha kwa floor.
As Kezia transitioned into adulthood, her condition only worsened as her body became a battleground.
I felt like my body was just fighting itself. I would be in severe pain that would have me on the floor, crying. It would cause, of course, vomiting, and the bleeding was very heavy with clots. So it was also a fight against anemia.
This alerted her to the fact that all was not okay, and so began the search for a proper diagnosis.
Endo is severely underdiagnosed, and its diagnostic rate is, anywhere from 7 to 10 years. So that's 10 years of just jumping from hospital to hospital. I even went to one doctor, and he was like, is it stress? And instead of giving me because I was telling him, please refer me to a gyna or somebody who can understand my problem, he wrote a name down, and I look at it, it's a counselor. And I'm like, what? I'm in pain. And he's like, nope, it's all just in your head, it's hysteria.
According to the 2019 Kenya Demographic and Health Survey, an estimated 1.2 million women and girls of reproductive age in Kenya, 15 to 49 years, suffer from endometriosis, some of whom suffer mental health issues as a result. Kezia struggled with mental, emotional, and professional consequences as she found herself increasingly unable to meet the demands of her job.
I got laid off from a job, and I was very sure it was because I was saying, it's also part of your performance, and you've been missing work on days when you have your period, so that's why we chose to cut you. And I kept, I'd try to work, get into trouble with HRs. So I felt like this thing was also stealing my life away.
And after years of searching for answers, Kezia was finally diagnosed with endometriosis 2 years ago, a condition where tissue similar to the lining of the uterus grows outside the uterus, causing pain, infertility, and in some cases, permanent damage to the reproductive organs. Surgery was her only option for relief.
So when I finally met the lovely doctor who believed me, she advocated for surgery because she was saying if you're in pain all the time, it might be endo, and it might have reached a point where it's on other organs. That's why you're in constant pain, not just on your period. And she was right. When we did the surgery, my bladder and my bowels were stuck together. Yeah, it's wild saying it. And, what they had to do was just remove the scar tissue, sort of try and separate the organs, and remove as much of the endometrial tissue as they could so that it wouldn't latch on to other organs in my abdomen. So, yeah, I was also put on some medication to try and slow down or prevent the growths from reoccurring.
Today, Kezia is on a journey of recovery, breaking the silence in the hope that no woman would feel dismissed or invalidated.
It's pain I would not want to wish on anyone. It's debilitating, it's horrendous, it's horrific. And, if you love the person, especially for parents, if you love your daughter, you don't want to see her in such pain. So please get her checked out. For teachers, please believe your girls. Even for HRs, that's why countries do push for menstrual leave, because while people can have cramps, there are others of us who are having just severe back-breaking, just mind-numbing pain.
It's the reason it's called the silence epidemic. Millions of women suffer without their knowledge. Well, on that note, we take a short break, but we still have much more, including a doctor who will be explaining to us more about what periods are. Welcome back, and thank you for staying with us. It's known by many terms: menses, menstrual cycle, or simply periods. Dr. Charles Muteshi is an OBS gynecologist. He begins by simplifying to us what periods are.
Periods are given the name because they come periodically, so every month. So if something comes every month, then it's periodic, and that's why they're called periods. And they are menses because they are, menstruation is a way in which the womb renews itself every time it has not had a pregnancy. And so you have a chance to have a pregnancy every month by ovulation, and if that does not happen, the womb prepares all the way, and if it fails, then it has to renew itself. So it sheds the lining of the womb where implantation or a pregnancy would have established, and then you have a bleed. Now, for that process to happen, it has to break itself down. So that breaking of the lining of the womb to establish a period causes, damage to the lining, and that damage is perceived as injury, and so the body, feeling that something is being injured, triggers the sensation of pain. But it also has ways in which it's supposed to lessen the pain. So if these mechanisms of lessening the pain are overwhelmed, then the periods can become very painful.
So now that you're talking about, the womb renewing itself, and that is what can cause also the pain when women and girls are going through their menses, for that matter. So does it mean that people who don't get their menses, because there are people who don't get their menses, does it mean that they cannot actually, the womb does not renew itself, and so that means they also cannot suffer, endometriosis?
Yeah, so the process of menstruation, like I said, is controlled by ovulation, which happens from the ovary. So if you release an egg every month, the body feels that, yes, a pregnancy should follow. Now, if there is an issue with ovulation, that you are not ovulating every so often, then obviously the womb will also sense that, I can't feel a signal from the ovary. So an egg has not been released, so there's no point in having a period. So you might have irregular periods. More commonly, this affects girls or ladies who have what we call polycystic ovaries syndrome. And the lay term for it is called hormone imbalance. So a lot of ladies will be told, or they will say, I have hormone imbalance. So they are not ovulating regularly. It is commoner immediately after periods start for about maybe 2-3 years, and then your periods become regular. And then towards the end of it, as you approach the menopause, again we have that irregularity before the periods disappear.
So when girls reach puberty, that is the time that they start getting their periods. Does it mean that someone can develop period pains or endometriosis immediately, or does it come later?
It varies from person to person. In a lot of ladies, it's something that may develop later because the body is trying to, establish a pattern of menstruation. I like to give the analogy of like going to the gym. You know, you go to the gym the first day and you'll be active and doing things. You don't feel pain or sore in your muscles. And then when you go the second day, you feel a little bit, oh, something's happening. By the third time, your muscles are really sore. And that should usually get better with time. But if it doesn't get better, maybe you've torn a ligament, then you need to see a doctor. So exactly like periods, you know, they might become uncomfortable, but mostly a lot of ladies will bear that discomfort because they've got internal ways in which the body tries to keep the pain low. But if the pain becomes unbearable, that it interferes with all activities of daily living, then it's the moment to see the doctor.
At what point then should someone be concerned about pain during periods or menses for that matter? What should you be concerned about at that time?
Yeah, so naturally, if you feel pain, you have an inclination to take some pain medication, and most people have access to over-the-counter like paracetamol or even brufen, and that can take away pain. If you notice that you're taking such simple medications and the pain is not getting better, then you need to think this may not be normal, and so you will need to see a doctor. When it comes to assessing or grading pain, we use a scale of 0 to 10. So 0 is no pain at all, 10 is the worst imaginable pain you can endure. And so if we have maybe pain levels of up to 2 or 3, that should not stop anybody from carrying on with their normal activities, because it's just discomfort. But when the pain levels start rising and reaching levels of maybe 5, 6, 7 on your own assessment, that is the point at which you may also need a pain medication. If this is persistent, then it's not normal. And obviously, if it's more than that and it's approaching 10 out of 10, where you can't do anything completely, you must go to hospital to have an injection to relieve the pain, and then that's also not normal.
So period pains are not normal, like you've already put it. What are some of the mental issues that you've seen among your patients who have period pains or endometriosis?
So the psychology of endometriosis or severe period pain is very complex. So we use something called a biopsychosocial model, because it's not only one factor that can lead into mental health issues. It's the support system you've got. So if you've got dismissive home or work environment, that you're in pain and people don't appreciate that you are in pain, then you feel isolated and you'll be alone and you have to deal with it just by your own devices. That can be very, very, distressing. And of course, if pain is persistent, then it tends to evolve into, other forms of pain. So you might have pain that is not treated, and then it becomes continuously present. So initially it could have just been with your periods or with ovulation. Because it's not been managed properly, then it becomes persistent. So when it's perpetually present, it makes you feel, very mentally abandoned, and our bodies have got so much they can take in. And of course, if your periods are predictable and they come every so often with pain and other discomforts, then you become very anxious about it. And so when these symptoms are persistent for several days, weeks, or months, they could lead to depression as an illness. It's not uncommon that lots of our girls suffer from mental health effects of these conditions.
It's sometimes not very easy to understand how painful someone may be feeling when they're going through their periods or something of that sort. How would you advise them that people around them, maybe employers, they could be their spouses or family members, what kind of support should they give to someone who's going through this kind of pain?
Yeah, in many ways. So the first instance would be if someone falls down and they say, I feel I might have broken something, or I'm in pain, it's very likely you will offer a helping hand. You'll support them, or you'll offer a painkiller because they have got pain. With period pains, it is not visible. You don't see periods, and you don't see the pain, but you need to accept that this person says she's got pain, and this pain tends to be coming so often. So when it does happen, first of all, offer that help. Give some pain medication, give that paracetamol, give that water, let them take it so that they can feel better. But beyond that, understand that they may not do everything they would normally do adequately or even well. So excuse them from their normal chores so that they may concentrate on looking after that. But more importantly, encourage them also to see a doctor so that whatever is causing the discomfort or pain can be addressed. We always advise that if a patient comes to the doctor, it is important for them to come along with someone else, because if you are in a mental state of pain, you will hear certain things, but you may not hear everything that the doctor is saying because you are distressed. And so if this person can accompany you, they will be, your second pair of ears to understand what is the plan and what is happening.
Endometriosis or period pains comes as a result of going through your menses. Is there an age group, for instance, that cannot be affected by endometriosis? For instance, women in their menopausal age, they don't receive their menses. Is it possible for still someone to have endometriosis at that age?
Yes, it is possible, but the common trend is that after reaching menopause, the symptoms tend to get better, because these are symptoms that mostly come with periods. So at the menopause, periods cease. But we do have instances where endometriosis, especially very deep endometriosis in the tissues, can still be active. Or in ladies who are in menopause and they need to be put on hormone replacement because these are hormones that may reactivate those areas that have endometriosis. So it has to be very tailored and carefully administered so that the symptoms don't come back. The concept is usually goal-directed treatment. And when we say goal-directed treatment or management, it means that we address the symptoms that are causing you distress. It could be related to pain, it could be related to fertility, it could be related to quality of life. So you have to ask the patient, what is the most bothersome symptom? And you focus on it. And having a diagnosis of endometriosis, as we know, doesn't have a cure. So what is the management? There are instances where someone can be happy to take a pill and they continue with it for life or even longer. There will be instances where it is very necessary that an operation is needed. And when an operation is needed, then we do a laparoscopy to remove the areas of endometriosis. And beyond that, of course, manage fertility if it's an issue. So it's always goal-directed treatment.
Does endometriosis also affect fertility?
It does affect fertility, and in fact, 50% or a half of patients who come for fertility treatments may be found to have endometriosis. My message is always the advocacy, both to the patients and also to the medical profession, that let's be aware of endometriosis and let's not have endometriosis diagnosis as the end of life. There is much more that we do for patients with endometriosis, getting yourself the right support and the medical physicians who can come and learn how to manage their patients, because as we said, 1.2 million ladies out there with endometriosis, it is not possible to be managed in one center. So we need to have expertise out there.
And so, just as the doctor has explained, endometriosis is not just the physical pain. It can also cause emotional and psychological trauma on the sufferer. And so, on Good Practice, we want to look at some of the myths and misconceptions of endometriosis. Due to the complex nature of the disease, there are a lot of myths and misconceptions about it. Let's review some facts versus fiction about the disease. Myth: endometriosis is rare. The fact is, endometriosis is one of the most common gynecological conditions and is estimated to affect 1 in 10 women of childbearing age in Kenya. Myth: endometriosis does not occur before age 20. Fact: endometriosis can begin as early as a girl's first period, so teenagers aren't too young to have it. Many girls experience symptoms during adolescence but aren't diagnosed until their 20s or 30s because their painful periods are dismissed as normal. Myth: endometriosis equals infertility. Fact is, too many young women believe that having endometriosis invariably means they will become infertile, while 30 to 40% of women with endometriosis have issues with their fertility. Many still go on to have children. Myth: endometriosis is only bad period pain. Fact: endometriosis is so much more than painful periods. Many women with endometriosis report tremendous pain or cramping before, during, and after their periods. The pain does not go away with pain relief drugs and can even affect your ability to work or go about your daily activities. Myth: pregnancy cures endometriosis. Fact: there is no cure for endometriosis. Pregnancy may temporarily suppress the symptoms of endometriosis because of increased progesterone in the body, but it does not eradicate the disease itself. Symptoms usually recur after childbirth. Myth: there are no effective treatments for endometriosis. Fact: mild cases of endometriosis can be treated with hormone therapy and other medications, including the birth control pill. More severe cases may require surgery. In many cases, infertility can be successfully treated with fertility drugs, insemination, or in vitro fertilization. On that note, we've come to the end of the program. As always, thank you so much for your time. On behalf of everyone who made this program possible, definitely the production team and our guest Kezia Mumbi and Dr. Charles Muteshi, OB gynecologist, for his insightful information. And so until next time, my name is Maria. Remember, if you've missed any part of this program, you can always catch it on our YouTube channel.